Hey everyone, welcome to week 4. This week, as a reminder, your case studies are due. So, as usual, if you have any questions or any concerns, please feel free to email me so that I can further assist you in anything that you have. So, this week we're going to be talking about some different family therapies as well as trauma. And unfortunately, in our field, everyone we meet has a form of trauma that has impacted them. Now, I want to remind you that trauma is not always abuse. It could be such things as divorce, death in the family, maybe a new move to a different city, death of a pet is a big one, a family member who is in the military. So, for some, we may not see them as traumatic, but for that specific person, it is very traumatic for them and it is very big in their lives that they cannot deal with, which is why it's causing them distress. So, abused and neglected children are a population that most gravitate toward when they hear of abuse and of trauma. So, naturally, the child welfare system plays a huge part. And from reading a lot of your posts and reading a lot of your emails, a few of you actually work in the child welfare field, so you are not new to this conversation I'm going to have. And every state is very, very different with their child welfare laws. So pertaining to your state, each law is different. So there are many cases that I'm sure you've seen on TV, unfortunately, that a child is found dead or malnourished, and maybe the caseworker wasn't doing their job. And unfortunately, that could be a common role, as there are a bunch of states and counties that are extremely overwhelmed with the amount of referrals and calls that come in, and the state's resources just cannot keep up. So, unfortunately, this is where some cases get lost. And child maltreatment is defined as physical, emotional, sexual, verbal abuse, and neglect. And physical abuse is obviously if there's any physical signs of abuse on the child. Emotional abuse is when you're emotionally abusing the child, saying verbally nasty things to them, beating them down, kind of like a bully. Sexual abuse is when there's unwanted sexual contact with a child. And neglect is when they may be neglecting to take them to the doctor, or neglecting to take them to school, things like that. So as social workers, we are mandated reporters. So if we suspect or we're told of abuse, we are obligated to report that to our state hotline. Now, I wanted to touch on the fact that a lot of us will have adult clients, and most people automatically think that if a child tells us about abuse, we have to report it. And yes, even though that is true, if adults tell us about abuse, we still must report it. So a lot of our adult clients who say, hey, I smacked Johnny on the butt the other day, that's still a reportable offense. So you have to be very open and honest with your clients when you're talking with them about abuse, that if anything should come up about abuse, if anything should come up about abuse, you have to report it. So unfortunately, a lot of our clients who have substance abuse, a lot of them acknowledge that they've used substances in their home. And it's one thing to be very knowledgeable of, it's where are the substances? Can the child get a hold of the substance? These are all things that you need to be extremely mindful of, because if you are dealing with an addict parent and they are admitting to using in the home, the heroin could be in the home, cocaine could be in the home, the 3-year-old could get into it by accident. Even such thing as even if they're smoking marijuana, helping them understand that a child still can get a hold of those things. So now, in most states, reunification is the main goal. So a lot of states have adopted different types of family therapy. So I'm going to go over some of the common ones. So PCIT is very common. So that is parent and child interaction therapy. So that focuses on ages 2 to 7, pretty much in the parent and caregiver relationship, and decreasing the external child behavior problems and increasing the social skills, cooperation, and attachment with the parents. that therapy is mainly focused on positive reinforcement. So a lot of the activities are actually in play therapy. So it's actually engaging the child in play therapy at the same time while the parent is positively reinforcing them. That's how a lot of the relationship is built through PCIT. The next common therapy that's used is structural family therapy, and that's a spinoff of systems theory because it's an aspect of each family member has its own system within their own life, and they bring that own system to the system of the family, which actually creates a system of chaos if it's not all together. So structural family therapy focuses on providing structure to the unspoken rules, and they help organize the family. So it focuses on establishing boundaries, rules, roles, and dismantling triangles. So triangles are often established when you think of, you could say, a bad child. So where it's like mom, dad, a child, that's the triangle against maybe the younger child who's kind of the wild child, doesn't follow any of the rules, but they're that way because the triangle is formed and they feel abandoned and neglected and isolated. So that younger child thinks, well, whatever, I'm not in with the triangle in therapeutic terms, so I'm just going to back away from that relationship. So structural family therapy really focuses on the individual structures inside of the family and breaking down whatever cliques there are in the family and helping everybody understand what role they play and what the rules are and what boundaries are, so that everybody can feel comfortable and move forward. And that therapy is actually very highly effective when done correctly. There's actually a lot of documentation on it. The next therapy that's used quite often is multi-systemic therapy, so MST, and that's an intensive therapy designed to make positive changes in social systems, such as school and peer relationships, that can contribute to serious antisocial behaviors of children and adolescents. So this therapy is often used for actually children in child welfare placements because they're at risk of being placed, they're at risk of going to residential treatment, they're at risk of going to a juvenile detention center, some may be at risk of going to inpatient hospitalization. So these are for more of your high risk child and adolescents that just can't seem to really get it together. So MST is really focused on those antisocial behaviors, that conduct disorder behavior, that we tend to see in those children. So MST is actually very, very effective when it is done correctly as well. And this can be done in foster families as well. It's also been done with extended families like we talked about, where grandparents are adopting the role of mom and dad, or aunt or uncle, or vice versa. So now for those who have experienced trauma individually and outside of the family unit, there are signs and symptoms such as self-harm, substance abuse, flashbacks, panic attacks, nightmares, etc. So trauma is defined as an exposure to a stressful event that causes psychological and physiological harm or pain. So some therapies that are common to treat trauma are EMDR, DBT, and CBT. Now, EMDR is focused on the rapid eye movement, and that's, if you've ever seen a video of EMDR, you'll know what I'm talking about. If not, I actually encourage you to look it up because it is actually extremely effective, and it's extremely interesting to watch if you've never really seen it or understood it before. So it really focuses on talk very little in the therapy session and a lot about the eye movement. So a lot about moving your eyes. And a lot of therapists have different techniques and different mechanisms to create the bilateral stimulation. And there's research that the bilateral stimulation actually helps the brain process the trauma. So it's actually, you're going through therapy, but you're not talking about it. And a lot of patients who experience trauma really like that therapy because of the fact that they don't have to talk about it. They have to talk about it very little. And then when they have that thought, the eye movement or the bilateral stimulation occurs. And that's when the processing of the brain occurs. So A lot of clients that like this type of therapy are veterans because of the fact that they've just seen so much and they felt so much that for them to relive all that is extremely painful. So for them, they really like to go through EMDR. So DBT is great for personality disorders. Your borderline personality disorders are perfect for DBT, and also that like constant suicidal patient. So you get that patient who is suicidal. Every time maybe they've had a lot of hospitalizations, but no matter what they do, no matter what medicine you get them on, they are just suicidal, passively suicidal, actively suicidal. They just can't seem to be happy in their own way. So DBT is very effective that way because it really breaks down kind of what is going on and how the behavior is really affecting their cognitive distortions, which brings me into CBT, which is great for a lot of the mental health disorders like depression, anxiety, and a lot of attachment issues, because CBT, as we know, really focuses on that cognitive distortion and really breaking down the barriers that people have put around that cognitive distortion so that they can move forward. So some helpful exercise that I actually use in practice, and there's a great few examples in your readings. So I really encourage you to look through your articles to kind of go over what exercises you could use in therapy. But some that I use are guided imagery, and that is huge because a lot of people don't like to feel the pain, and sometimes their body gives them a physiological response. So what you can do is help them convert that pain into something that they're going to be able to relate with. Maybe it's a shape, maybe an animal, maybe a color, maybe a person that they make up and they pick the name for. So once they've identified that, you kind of get them to move, in their guided imagery to, now my anger is converted into this purple square. And in my head, I am pushing beams of happiness into this purple square to get rid of my anger. So using stuff like that with guided imagery helps a lot of patients sometimes because they don't really know how to express themselves and they don't really know how to manage their own physiological response. So when the guided imagery, when you set that there for them, it actually extremely helps them a lot. Another thing that I use is called a grounding technique, and this is really used for patients that are in extreme distress during therapy. So when they may be having a flashback during therapy, what you can do is actually ground them. So, tell them to start rubbing their feet on the ground, rub their hand on the chair, ask them to, look around the room. What do you see? Do you see me? Helping them come back to that safe spot, helping them realize that they've grounded back to reality. They're not in that current trauma state that they were thinking that they are. They are safe. So grounding really works for those patients who truly, when they go back to that trauma, they really go back. So for them, that's very real. So grounding brings them back. Another common thing that I use is the safe place. So a lot of people, they don't really know where a safe place is for them. So to help them, once again, a little bit use of guided imagery, help them create a safe place, whether it's a house by the beach, whether it's a cabin in the forest, by a lake, whatever is their safe place for them, you need to help them create that in their mind. And then, for example, if I go back to my anger, which is my purple square, when I'm in my safe place, I put that purple square in a box that's bolted and it can't bother me. So in my safe place, I am always there. I hear the ocean. I hear the birds. I feel the sand on my feet. I'm in my safe place and my trauma cannot touch me. It's bolted in that box that cannot come out. So really using techniques like that can really, really help a patient to really get through their feelings a lot easier, because sometimes, as I keep saying, talk therapy sometimes is too much for them. So these are just some examples. You don't have to use them, but I use them quite frequently and I find them very, very helpful. So I thought I would just share. Trauma is prevalent in our field, so I want you to make sure that to keep your own mind healthy and to keep talking to coworkers and talk to supervisors, because it can be extremely stressful at times. especially when it's immense trauma on someone and they talk to you about it and then it becomes you. It's very difficult. So please make sure you're being open. And, you know, our lives are different, so I ask that you separate your personal life and your work life. You know, don't go home and talk to your spouse about, you know, I met this girl today who was raped. I met this, you know, boy today that has been in a domestic violence relationship. Sometimes that's hard on a spouse as well. So I think that you really need to be able to process that individually. And don't bring it into your personal life, because I can see that happens sometimes, especially when I'm talking to coworkers and people that I supervise. So it's just something to be mindful of as well. So if you're watching this video, what I want you to do is, if you can email me maybe a trauma therapy that you are not as familiar with, that you would like to be familiar with, and I will give you a zero point 0.5 extra points in your case study coming in your case study. Okay. If you have any questions this week, please email me. I will always be available. All right, everyone. I hope you have a fantastic week.